Hey, hello, friends. It's Joe DeMattos from HFAM. Thank you so much for tuning in for today's session. We are so blessed to have Eurofins as an HFAM associate member, and we're so proud of what they do for our skilled nursing rehab centers and other partners here in Maryland, and quite frankly, across the country and in Europe. We're joined today by Annemarie Watson. Annemarie, how are you today?
I'm great today. Thanks, Joe. I hope you're doing well as well.
You know, I'm doing well because I'm amongst friends as we continue in this fight against COVID-19. So on the one hand, you know, we're all working 7 days a week, and it's kind of brutal. But on the other hand, we're uplifted and supported by friends and colleagues like you. And, you know, we've got to make time to uplift one another, to share some smiles with one another, and to compare notes on this battle that we have going on with COVID-19. So I mean it genuinely. I can't thank you enough, and I can't thank Eurofins enough for all that you're doing.
Thanks, Joe. It's great to be here with you today, and you know, it's great to share our thoughts on this. And as you said, get through this together.
We will. So let me ask you. You know, we're fighting this newest surge of COVID-19 across the United States. In some communities in the United States, it's the first or the second surge. In this part of the country, it's really our third. Obviously, we've been focusing a great deal on commercial lab testing, and that's very important when we get actionable results in a timely manner. It's one of the tools that we use to fight COVID-19. But from a larger infectious disease protocol standpoint, you know, looking at the whole scenario in the fight, in addition to commercial COVID-19 testing, what should nursing homes and hospitals and others be focusing on right now in terms of infectious disease protocol?
Mm-hmm. Well, I mean, there's a handful of things, and it's a particularly interesting question as we go into flu season, right? And you really want to focus on fortifying these campuses so you're ready. And we're in a very, I would say, fortunate position now compared to where we were, say, in March and April, because we are in a lot of cases more ready. You know, we have thought through a lot of these battles. We've learned a lot. We're now stronger. We understand a lot more about COVID than we did back then. And so, you know, it's having that PPE. It's, you know, what we always call sentinel testing, right? So you can test patients, you can test your workers, you can also test the environment, you can test surfaces, you can test wastewater. And so putting together that full strategy so that you are working to, as I was saying earlier, fortify your daily workplace and living place so that you're ready to tackle both the flu, for instance, or COVID through, you know, consistent processes that you've prepared and you've trained for again and again.
You know, it's interesting. This surge is different on a sort of negative side in one way and different in a positive side in another way. I guess I'll start with the positive. We have learned a bunch. And so even though we are having more actual outbreaks of one case or more, at least knock on wood and please pray, we haven't seen those huge hot spots that we saw in March and April yet. I'm sure we'll see some, but I think given the learnings, the hope and the prayer is that we will see a fewer number of those. And then, you know, it's so interesting you mentioned surface testing and wastewater testing. You know, we've been in discussions with Eurofins now for a couple of months on those two types of methodologies. And it was sort of cool, you know, to use a technical term, but it was sort of cool to see some of the state and other epidemiologists recently talk about the value of wastewater testing. So let's delve a little bit deeper. What have you learned? What have been some of the learnings at Eurofins with regard to not only testing and sentinel testing, but surface testing, mask testing, and the wastewater testing? What are some of the learnings?
Well, it really gets to different ways that you can monitor the environment without necessarily testing your people on that daily basis. Most people don't want to be tested on a daily basis. And in general, you really just want to understand if COVID is in your environment quickly. And as soon as you understand that it may be, you're going to go deep and you're going to go into some of the clinical testing which, by the way, there's quite a few tests. Everybody says the PCR is is always the gold standard. By the way, the environmental testing, the wastewater testing, the surface testing, it is PCR testing as well. It's the same technology that you use when you're testing a human in clinical testing. You're just testing the environment so that you're not, swabbing that human on a daily basis. But there's a lot of tests now. As you said, we're better prepared than we were back in March, April, and in the summer peaks in July and August. We've got some point of care testing we can use. We've got the PCR testing that we can use to confirm if we've seen some warning signs, either through the Sentinel or that point of care testing. And our responsiveness is much better than it was back when there just wasn't the same volume of testing that there was back in March, April. So the actions you can take now through wastewater, through use mask testing to determine where you've got an outbreak and then take really quick action are so much better than they were back in March and April when you had those screens, but you couldn't actually respond quite as quickly as you absolutely can today.
Well, I think you've pointed out a couple of positive differences. We have testing volume has increased, so that's a good thing. I continue to worry about quick turnaround on commercial testing because the results have to be actionable. You mentioned also just now what I think is the beginnings of some advice, and that is know what you're dealing with and take quick action. So if you had to identify 3 pieces of advice for a leader in a nursing home or assisted living or in a hospital even now, if you had to give them 3 pieces of advice here in November with everything that you've learned since March, what would be those 2 or 3 pieces of advice?
I think the first one is absolutely, be ready, know your processes. It's not if you're going to have COVID in your facility. I think as everybody knows, you will, and you already have in most cases, but what exactly is your process? So that when you have that detection, you know exactly how you're going to test the first person. You know exactly how you're going to contact trace. You know what your first set of testing response is, and then you know what your follow-up is. If your first one, say you're doing an antigen right away, you say, okay, I'm going to get an indicator from the antigen testing, and then I'm going to follow up with PCR to confirm because I've now narrowed this down so I can have quick antigen. And while those people are waiting what might still be a day for a response, by the way, not 5 to 7 days as it used to be, what might be a day for that response, you know that you're keeping them separate, you know that you're quarantining them. And so it's really, I would say number one is just know what your plan is and be ready to act. And then number 2 is have those tools at your disposal. So when you are ready to act, you can act very quickly.
No, I think that's super, super helpful. Look, we did one video previously. We're doing this one now. But let me ask you something. Does Eurofins offer online training or online in-service for people that work in skilled nursing and rehab centers?
We do. I'm glad you asked, Joe. So we have 2 kinds of training. We do have online training for employees on infectious disease. And then we're also developing an infectious disease risk mitigation and business continuity training, which is a full day-long training. And so the first is available now. The second one is available, I believe it is as early as next week.
Well, that's really helpful. So who should take these courses?
Well, I think you want to think about these courses for all of your employees to a great degree. You want to have that plan, and then you want to reinforce that plan with this training. And people forget things when it's not top of mind, right? So you want to have that initial training and then some way to revisit it, just to make sure that everyone is refreshed, you're on track, and that you know what to do when you have that situation arise.
Well, Annemarie, that's incredibly helpful. And again, we need to continue to make time to learn from one another, and we need to continue to make time to look at each other like this and reinforce and send some smiles and support to one another during this critical time. Those of us who are association executives and who are standing aside, behind, and lifting up our healthcare heroes know that we're in this fight for years and not months. We believe that the intensity of this fight will be a March to March event. Obviously, we're incredibly optimistic and, again, praying for the distribution of these 2 vaccines that look so very, very promising. And nursing home residents, patients, and healthcare workers are set for priority in terms of receiving those vaccines. But the reality is it's going to take months and months to appropriately vaccinate people across our country. And we do have this co-occurring flu and COVID season that is happening now through the fall and the winter. And so we're going to need one another to get through this. And I'm confident that together we will. So I can't thank you enough, and stay strong, stay well. And will you do me a favor? Will you take this message back to the Eurofins team and tell them that we really appreciate them, please?
Absolutely, and we really appreciate you, Joe, and we really appreciate the organization. It's just tremendous to try to do our part and help out, and work with such teams that are, as you said, really been superheroes in all of this.
Hey, thanks so much.